Thank you for joining us for the 4th Annual Global Summit on Kidney Innovations, Global Kidney Patient Voice, the Key to Accelerating Innovation, a collaborative partnership between the American Association of Kidney Patients and the George Washington School of Medicine and Health Sciences. My name is Kevin Fowler, and I'm a former board member for the American Association of Kidney Patients, and I continue to serve as a AAKP Ambassador for the state of Missouri. I'm also someone living with kidney disease, having received a preemptive kidney transplant in 2004. And based upon my experience of living with the consequences of polycystic kidney disease and facing the reality of kidney failure, my goal was to avoid dialysis by receiving a preemptive transplant. And my hope for all individuals suffering from kidney disease and facing kidney transplant is for them never need to go on dialysis and to receive a preemptive transplant, so that a preemptive transplant becomes more the norm rather than the exception as it is right now. And as a fellow patient advocate, or as a fellow patient, I have a deep passion for patient advocacy and patient engagement in the production and device lifecycle of novel treatments that answer the need and preferences of patients and their families. And those that are going through the journey of kidney disease firsthand, who really know what it's all about. This passion has led me into a career spanning over 30 years in both commercial and research and development roles for commercial enterprises. In addition to my role with the AAKP, I'm also the patient editor for the Clinical Journal of the American Society of Nephrology, CJSN. I'm also on the board of directors of the Kidney Health Initiative, which is a public-private partnership between the American Society of Nephrology and the US FDA. KHI has a mission to catalyze innovation and development of safe and effective patient-centered therapies for people living with kidney diseases. And for today's session on Global Kidney Patient Voice, the key to accelerating innovation, industry efforts across the globe advancing kidney patient care, I had the pleasure of conducting a series of interviews with national and global companies in the kidney space that are leading the effort to disrupt the status quo by making an investment in new treatments to address the many unmet needs of people living with kidney diseases, while also working tirelessly to integrate the patients and their unique insights along the way. In full disclosure, based upon my professional background working with life science companies, I have consulted for some of the organizations that I have interviewed. I enjoyed speaking with all these industry representatives across the globe and ask you to join me in watching excerpts of these interviews. Full interviews will be available post-Global Summit on demand on AAKP's social media platforms and YouTube channel. Thank you, and I hope you're just as inspired listening to these discussions as I was conducting them.
So this is very important. I would encourage patients to learn everything they can about their disease, to try to connect with each other, as well as to help educate each other. It's important to be proactive as an advocate for yourself, as well as for others, for other patients. So there is a major unmet need in kidney transplantation, particularly involving a serious infection that happens after transplant called BK virus. BK virus leads to significant morbidity and mortality in kidney transplant recipients. Most humans have been infected with BK virus, but it remains latent and benign in healthy adults. BK virus can reactivate when a patient is very immunocompromised, such as when a patient undergoes a kidney transplant. Unfortunately, BK virus nephropathy is a leading cause of kidney allograft loss, and there are currently no approved therapies to treat BK virus after kidney transplant. At Vera, we have the first monoclonal antibody that neutralizes BK virus in renal transplant recipients. We are progressing this monoclonal antibody now through clinical trials in renal transplant recipients, and we're very excited about its potential for treating patients with renal transplant. So as a clinician and also as a leader helping to research new medicines, it is very important that we place patients first in everything we do at Vera. Partnering with advocacy groups is a priority for us, not only to better understand the patient experience, frustrations, and outcomes, but to also be good listeners when it comes to how we can be better at research and new medicine development. We see patients as a true partner in clinical trial development. Hi, everyone. Thank you for the invitation today, and thank you as well to the organizers for creating this wonderful community for patients. My name is Celia. I am the Chief Medical Officer at Vera Therapeutics, a biotech company near San Francisco. Vera is dedicated to improving the standard of care for patients with serious autoimmune and immunologic diseases. All three of our late-stage clinical programs are related to kidney disease, specifically within the areas of IgA nephropathy, lupus nephritis, and kidney transplantation. Our lead clinical stage medicine, atacicept, is potentially a disease-modifying agent that we hope can be used to treat serious autoimmune conditions that damage the kidneys. Just to speak briefly about the two autoimmune diseases, IgAN, or IgA nephropathy, is a serious progressive disease in which autoantibodies can cause cumulative damage to the kidneys over time. Up to 50% of IgA nephropathy patients progress to end-stage renal disease, resulting in the need for dialysis or transplant. Unfortunately, standard of care is currently suboptimal and consists of ACEs, ARBs, and steroids. Another condition called lupus nephritis is a severe renal manifestation of systemic lupus erythematosus. Many patients unfortunately progress to end-stage renal disease, and current treatments are also suboptimal. At Vera, we are dedicated to developing new medicines that will fill these unmet needs of patients with IgA nephropathy and lupus nephritis. The decision to enroll into a clinical trial is a joint decision between the patient and the physician. Patients can be proactive by learning about various clinical trials that are underway. Patient advocacy groups are a fantastic resource in terms of keeping up with the latest disease information. At Vera, we regularly invite patients to learn about their experiences. We are initiating later stage studies, including phase 3 trials in IgA nephropathy, lupus nephritis, and renal transplant recipients soon. Information about our trials can be found online, and you can also ask your doctor about trials that might be taking place in your area.
I'd like to thank again the vast number of industry partners that took the time to sit down and have a discussion with me. Through AAKP Global, launched in 2019, AAKP is engaged globally because we are committed to educating patients, leaders, and companies across the globe on the importance of kidney disease prevention, new innovations in treatment, and the opportunity to save more lives. We believe that united patient voice can drive innovation and the policy decisions that determine timely regulation and payment for new and safe treatments. Globally, AAKP is working with patients, medical professionals, researchers, and medical industry allies, such as those you just heard from, to cultivate a united consortium led by patients. AAKP believes that this global consortium can advance innovation and change kidney care in countries where health systems or infrastructures do not support patient-consumer choice or access to care treatments. Again, thank you to each of our industry partners for sharing with us the innovations their companies are working on or has available to improve kidney care from prevention and diagnosis to transplantation or access to care treatments.